You're on.
Okay, so blood transfusions. What are some of the first things that you guys are going to need prior to starting your blood transfusions?
An order from
An
the
order.
physician.
A consent.
Type and cross.
Type and cross.
Initial vitals.
Vital signs. NIV.
IV sign.
What is your preferred gauge of an IV?
20.
18 preferably, 20 if it's running well. So you have all of your equipment set up, you've got your consent signed, you have your order, you go down to the blood bank, you grab your blood, you check out your blood, and how long do you have to transfuse your blood once you've checked it out?
4 hours.
4 hours from the time that you start your blood?
No, from the time you check it
From
out.
the time that you check it out.
I was looking at you for these.
So you bring your blood up to your patient, you have your second nurse there with you. You're gonna verify with your second RN, what are the things that you're double checking and verifying?
The W
The W number, the name of the patient,
S
the
number.
S number,
Blood
expiration
type.
date, blood type. Okay, you wanna also inspect the bag, make sure that there's no blood clots, the color looks good. So you have everything double checked, you're ready to start your blood. When you start your transfusion, how fast are you gonna start it?
95.
About 95 milliliters per hour is normal for the first 15 minutes to see how your patient's doing, how they're tolerating it. And within that first 15 minutes, you're going to be looking for signs and symptoms of transfusion reactions. Transfusion reactions will happen very quickly, usually within the first 50 milliliters of blood that's infused. Once you have your transfusion running, your patient tolerated 95 milliliters per hour for the first 15 minutes, they're doing well, you're going to bump up your the rate. How fast are you going to give it?
120.
About 140 to 200 milliliters per hour is about normal. Depending on your patient, obviously you're going to watch for signs of fluid overload and things like that. If your patient's pretty fragile, you're going to keep that on the lower end. You just want to make sure that you're infusing it within that 4-hour time limit. Usually about 125 milliliters per hour will get you exactly on that 4-hour time limit. So within that first 15 minutes, like I said, you're going to be watching for transfusion reactions. What are some signs and symptoms your patient might exhibit for a reaction? Shortness of breath. High back pain, hyperthermia, so a rise in temperature, how high? 2 degrees. What if you're in OR or surgery center?
2 degrees higher than the pre-op.
Go by the pre-op vitals, correct? 2 degree rise in temp above the pre-op vitals. What other symptoms? Tachycardia, chills, rash, hives, anything that you would see with an allergic or anaphylactic type reaction. So say you start noticing signs and symptoms of a transfusion reaction, what is the first thing you do?
Stop the transfusion.
Turn the blood off, right? What do you do next? Call the lab. Who's the next person you call?
The physician.
To the provider. The provider says, oh, it's fine, it's not a reaction, go ahead and finish the blood. No. Who's the only person that can tell you that the blood's okay to continue to transfuse? Yes, lab, the pathologist. So the lab, once you notice you've called the lab, you've called the provider, you've stopped your blood, you want to make sure then you disconnect the tubing from your patient. So we've changed the policy. Previously it did say that you would leave the tubing hooked up. You're going to take the tubing from your patient and then you're going to cap it with a sterile cap. Why?
So it doesn't get any infections in case there was an infection already.
Okay.
Or do you have any?
Send it back to them.
Yeah, because if they're not having a true reaction, we can finish giving the blood, right? So you want to keep this aseptic, keep it a closed unit so you're not introducing bacteria. You never want to, I know the tubing doesn't have it, but you don't want to connect it to a Y site because increased risk for infection, sepsis, all of that. So once you've disconnected it from your patient, you want to grab another bag of saline and new tubing and flush that line. Okay. On your transfusion record, you're going to document that, yes, you had a transfusion reaction, and on the back here, you're going to fill out your signs and symptoms here. Okay. And lab is going to bring up this form for you. And then it's the transfusion reaction record. You're gonna fill the top portion of it out, and then the lab will fill out the rest. When you are finished with your transfusion, say everything went fine, say you're going to transfuse 2 units of blood routinely. Each one of the units of blood will have its own sheet, okay? Somebody tell me the sequence of vital signs that you're going to obtain while you're transfusing. Your initial vital signs within 30 minutes, 15 minutes after starting, an hour after starting, and an hour after completion.
So then the next one, there's a line for if it's continuous or sequential, whatever, consecutive, thank you.
Okay,
There's
yep.
a side line for that.
So if you're giving a routine infusion, once you're finished with your first unit of blood and you've hung your second unit of blood, you still want to keep in mind that after the first unit, you need to get your 1 hour after completion vitals, even though your second unit is running. So just keep in mind that your units of blood the vital signs are independent of each other. Okay, does that make sense? Okay. If you were to be giving blood in an emergent situation, back-to-back units in a very short amount of time, you would utilize this portion of the form and then fill out the information as needed on here. Try to obtain as many vital signs as you can within the parameters, and then either write that on here or you can attach the vital signs with the sheet. And then if your patient is being transferred to another facility and the blood is still infusing, you want to make a note somewhere on your form, patient transferred to Stormont Vale, infusion continues or is still going or something like that. Or even if you're having just a routine blood transfusion, you just make sure you note in the margin somewhere that they were transferred so that the lab knows that you weren't able to obtain the rest of your vital signs and where you transfer them to, because they'll call and follow up with that facility and get the rest of the information they need for their record. With Junction City Fire Department and Lifestar, whoever you're sending your patient with, make sure that you make a copy of this front and back, give them the copy to take with them, and then we keep the original, so always keep the original of all the paperwork. And they are aware and know how to fill the rest of this paperwork out. Say they finished the infusion en route or they grabbed another set of vital signs, they can fill this out. Most of the time we're sending equipment with them like the pump, the thermometer, and they have to bring items back anyway, so they'll bring these forms back and then we can fill out the rest of that information.
And they'll bring us the blood tubing and stuff back.
Right,
During the lab.
so when you're finished with your blood transfusion, the lab needs their unit bag back. So you'll make sure that once you finish the transfusion, you flushed with your flush bag. You disconnect from the patient, you'll unhook just the blood bag, will go into your biohazard bag. If the patient has had a transfusion reaction, they will request the tubing as well, and sometimes the flush bag too. But if it's just a normal transfusion, everything went well, all they need is the bag. And again, like Caitlin said, the fire department will bring those blood bags back as well. Just remind them not to throw them away. Just in case they do have some signs of reaction later, then they can test the blood. So you want to put your blood bag in here, and on the back side of the bag, there's a pocket for your transfusion record, okay? We do not want transfusion records that look like this. Okay, this happens. These are real transfusion records.
I can see that.
So when we turn this in, the lab has to handle this, medical records has to handle this, they have to scan it in, it's a mess. When they copy this or scan it into the computer system, everything that's red shows up black, and you can't read any of this. You can't see the vital signs, you can't see when it was completed. So just keep in mind to use that back pocket, don't put it in with the blood bag. I think that's what happened with this. Okay.
A lot of times if the fire department's going to transfer their medics, they'll bring you your vital signs for you to be able to transpose them into your sheet. So
Yep.
you make sure like the original's completely filled out. And then I make a note on there that says obtained from
Perfect.
paramedic.
If you are the nurse that is drawing the blood for the type and cross, if you're the one that's collecting that pink tube, you need to be the one that's filling this out. Lab will bring this to you. This is just blood banding your patient. You'll put a sticker, patient sticker up here, an initial and time of blood draw, and then you'll fill out the armband down here at the bottom with the patient's name, account number, date of birth, your initials, the time you drew the blood. And then you'll actually put it in the wristband and band your patient. Okay. For routine infusions, make sure that you are filling out your blue form for the lab so that they have this information. Lab has developed a really good process for if you need blood emergently, they can get you blood very quickly. So we haven't had many issues with that as of late. So in that situation, you would need your blue form, but so questions so far? Okay, let's take a look at a couple of blood transfusion forms. These are actual forms. Take a look and tell me what you notice is incorrect with your transfusion records.
The vials.
1 hour after completion is not filled out.
And they're different.
Are they okay?
Show them. Yeah.
What did you notice about the vitals?
They put out vitals on here.
Yeah.
On mine.
But then your
And
vital signs prior to first unit and prior to this unit are the exact same.
So maybe this was their first unit.
Yeah, that's
This
happening.
is like way later.
So this one is way
So they
late.
checked it after they started the infusion.
Quite a ways after.
Say that again, Caitlin.
They checked it after they started the infusion.
So
Like, their times
on,
are off.
on both
Yeah.
of your guys' sheets, look at when the blood was verified with the two nurses and look what time it was started. 55 minutes later. How do you know that you've hung the right blood on the right patient?
Was this supposed to be 1955 and they wrote 20?
Right?
I would hope so, but that's
I mean, if they
scary.
verify,
You should check it out.
and that's the time they verify.
This is
when
what
they start their nursing school.
You're like, hang on.
I tried 2055 the same.
For those sheets that have the last set of vital signs, look
At
at the
1950,
temperature.
so this would be.
Also, I was just going-
Oh.
Where's the, does somebody else have the other one? Because these are both the same.
Yeah.
101.9.
Yeah. So did they have a transfusion reaction?
Yes.
Yeah, probably. Did they indicate that?
No.
Can I look at that one? We'll switch. Oh, that's the same one.
It's not, it's very similar.
Oh, so they're similar. Oh, so this is the completed version of that one.
Yeah. Okay. Any other questions on the paperwork or how to
Kick your
fill
butt
any
if
of
that
that out?
happens, you don't tell anybody. Okay, deal?
What?
Any questions on how to fill any of that paperwork out?
Having all of these. If they
Thank
don't
you.
verify a physician number three.
Yeah.
Okay, this is the new one. This is the. Yeah. Yeah.
Oh, okay. All the vitals.
Look at it, but, look at this.
What else?
Right, and then 101.
So what is that?